Bayanihan 1 or 2? No, meron move eh. Meron pong panukala.
Would you endorse that move to dispense with phase 4?
Very difficult, sir, to answer.
You're talking here about the safety of thousands and millions of our people who
Yes,
would
sir.
have to undergo the vaccine. Yes, there is a move
Yes, sir. Yes, sir. Yes, sir.
to waive this. Would you endorse this?
No, sir.
Would not
Knowing
endorse
what I
it.
know, Your Honor.
Okay, thank you very much, Mr. President, for your patience. Thank you.
Thank you, the Minority Leader. Just on that note, Secretary Duque, we all the word negative is better used in the pandemic that we're encountering, no? That the Philippines is encountering. But when you come to ethics, it's better that you're positive. In other words, why don't you present your statistics like we have already tested 1.8 million, 1.6 million negative, 160,000 cases, not active cases, cases, but 70,000 have already recovered. So active cases, mga 60,000, di ba, in total nyo. Why don't you present it that way instead of saying now it's 180,000 active cases? Di naman iba eh. So sometimes it's better to be positive than negative. Parang nananakot kayo eh.
At tama po kayo. Susundan po namin yung inyong sinabi, Mr. Senate President. Maraming salamat po doon sa inyong abiso.
All right, thank you. Next is the
Mr. Senate President.
yes.
Mr. Senate President, this is Pia, sir. With
Yep.
the indulgence of my colleagues, can I just ask one question? Follow up lang po sa question ni Minority Floor Leader. It's very important because we are in a BICAM sa Bayanihan 2 po.
Go.
Can I be allowed? Thank you. The question, this is addressed to Secretary Duque. Good afternoon, sir.
Good afternoon, ma'am.
The question of Senator Drilon was, would you endorse the waiver of the requirement to go through the stage 4 as required by the Universal Healthcare Law? Now, that was the question. And your answer was, you hesitated and then you said no, or you said you will have a hard time endorsing that. Something like that, no? Is that correct?
Yes, ma'am. Given that this is a novel
Okay.
vaccine evolving.
Okay. So my question is this. If the phraseology in the Bayanihan law would be such that if WHO and other countries with recognized and mature FDA, similar to how we wrote in Bayanihan 1, that's why I think you had some confusion. In Bayanihan 1, we referred to the mature FDAs who have approved testing kits. Dito naman sa Bayanihan 2, we are referring to mature FDAs who would approve the waiving of a stage 4. Would that seem acceptable to you? So I repeat, if WHO endorses, or these countries with mature FDAs, and I understand mature FDAs include the US, UK, and Russia din pala. So if they would allow and they are okay with doing away with that, are you prepared to endorse it? Or do you even have to consult other, hindi po kayo epidemiologists, hindi po kayo microbiologists. So do you need time to consult? Because this is very important to us. Thank you, sir.
I will consult the experts, Your Honor. But having said that, I think one of the guiding principles in our pandemic response is science should always be the basis of whatever decision we make, whether to waive phase 4 or and I think we have to be open to the experts, but there are many groups of experts as well, some opposing each other, some very divided, but some do have a very strong consensus, no? So makikipag-usap po kami. How much time can we be given, Your Honor?
Well, this is very crucial. I think we're hoping to wrap up the BICAM tomorrow, but I leave it to the leadership. I'm not the chair. It's just an issue that we were tackling yesterday. So I think 24 hours, but I can ask the chair of our committee, Senator Angara, but I think our deadline is tomorrow. But this is a very crucial issue. And for the record, Mr. President, I just want to spread into the record that I do not believe in legislating science. No, that's why we are asking these questions, because precisely we want to craft the wording such that we are basing decisions on science. So for the record po, because it's very important that our country's confidence in vaccination is preserved, dahil we already went through a trauma on vaccinations with Dengvaxia. Our country cannot afford another trauma. We cannot afford millions of infants not being vaccinated for measles, for chickenpox, for smallpox, for the polio drops because of erroneous decisions on this, Mr. President. So that's it, Mr. President. Thank you so much for indulging me. Unless the Secretary would like to clarify anything further. Thank you so much.
Well, just corollary to your statement, I just want to underscore that careful balancing of interests of health and time, and we will finalize our position paper on this with the advice of the Health Technology Assessment Council, which is a creation of the Universal Healthcare Law, the FDA, and also the Philippine Medical Association and its component specialty societies.
Sorry, Mr. President, one more thing just for the record. Natatakot lang po ako kasi na nami-misquote tayo sa mga napakahalagang issue na ganito. For the record, the reason there is a provision like that in the draft is precisely because we wanted to ensure that if WHO and countries with mature FDAs like the US are already using the vaccines and they have decided to waive stage 4, then hindi naman pwedeng tayo lang ang nakatali, yung buong mundo nag-vaccina. So for the record lang, kaya ine-explore itong provision na ganito. Thank you, Mr. President.
Just a response, Mr. President. The reason, and I agree with my colleague. We should base these decisions on scientific data. And that is why yesterday I said I will not participate in this proposal to waive phase 4 unless we have an assurance and an assurance from our health authorities that it is okay. It will not pose any danger for us to waive it, because we are politicians getting involved in scientific matters, waiving phase 4. That is why yesterday I asked that the matter be referred for appropriate judgment by the experts, and I think the bicameral conference committee agreed that we should get an expert opinion before we decide on this matter, and it is for that reason that I asked the secretary, being the head of our health sector. Thank you, Mr. President.
All right, thank you. Next is Senator Francis Pangilinan. You have 10 minutes.
Thank you very much, Mr. President. Thank you, colleagues. Magandang hapon sa kanilang lahat. I have a few questions on Philhealth, as well as related questions on contact tracing and mass testing for Secretary Duque. On the matter of Philhealth, Secretary Duque, magandang hapon.
Good afternoon, Your Honor. Good afternoon, Your Honor.
Bilang chair of the board ng Philhealth, ilang beses po ba nakapag-attend, kung meron man, ang mga actual na secretary, yung secretary mismo ng DPM, ng DOA, ng DOF, ng DSWD sa inyong mga pagpupulong?
Your Honor, halos puros kanilang mga representante lamang ang ma-attend, Your Honor.
Yes. I expected that. Pero I believe, given the serious challenges and problems that the PhilHealth is currently facing and the near vacuum of leadership now confronted with all these leaves of absences, baka dapat siguro mandatuhin na yung secretary mismo ng Secretary of Finance, Secretary of DBM, Secretary of DSWD, yung mga aktwal na merong kapangyarihan and meron talagang sabihin na natin the buck stops with them, dapat pumasok na rin at mag-participate dito sa mga board meetings na ito as we work on reforming and exercising more transparency and accountability sa PhilHealth Board. Would you agree with this, Secretary?
Absolutely, Your Honor. I will deliver that message to them personally.
Thank you, thank you. I say that because I was chairman of the board of two other GOCCs from 2014 and 2015. And these GOCCs were also handling billions of pesos worth of government funds. And they were facing serious management issues and challenges. These were the FA and the NIA. And my only request when I accepted the appointment was that the secretaries of Finance, Secretary of DTI, of NEDA, as well as the BSP and the LBP President for NFA would sit so that there was greater transparency and there was greater accountability. And we did the same with the National Irrigation Administration. We have asked the Secretary of Public Works to sit and not send his representative, thereby ensuring that there was greater participation directly from the heads of agencies. That is the reason, Mr. Secretary, why these boards designate precisely the secretary of the respective departments. That's the intention of legislation, para talagang mapalakas yung accountability at yung transparency. So baka ito ang isa sa mga dapat na agad-agad na maaaring gawin. Beginning today, perhaps in the next 6 months, just to reform the whole process and the decision-making sa PhilHealth. Dapat yung DOF Secretary, dapat yung DBM Secretary, at dapat yung Social Welfare Development Secretary kasama ninyo sa board para yung mga desisyon kwentas klara sa lahat, hindi po ba?
I agree with you, Your Honor. But in fairness, we've been having some meetings among the cabinet secretaries who sit in the board and addressing, of course, this very compelling issue of the actuarial sustainability of the system, given that the collection challenges on account of the business that had been shut down because of the pandemic. But rest assured that we will continue to take this up, and I will deliver to them your message that perhaps it's helpful for the organization to have no less than the cabinet members of the board.
And considering, yes, Secretary, and considering that we are in a pandemic situation, and it is unforgivable for the PhilHealth not to be able to deliver its health services and the resources necessary to address the pandemic, mas mabilis ang magiging kilos kung yung secretary na mismo ng departamento nakaupo para agad-agad na didesisyonan. Hindi yung makupad at matagal tayong naiipit sa burokrasya. So that I think I was listening to Ralph, Senator Recto, as he was identifying the roles of these various representative execution members of your board, and I feel you will have more synergy, di ba? And you will have you'll be better armed. Mabilis na magiging decision dyan. We were able to precisely make painful and difficult decisions as we reformed the NFA then. We were able to reduce rise inflation from 15% to 0.8% in 1 year, precisely because you had the cabinet secretaries all out supporting our efforts. So I recommend that, Secretary, and I'm glad you're open to it. And I hope to see them actively participating in the PhilHealth board meetings, even just for 6 months. just to put things in order and get your organization in the right track. So thank you for that. We hope to be able to see that, and maybe we will recommend that in the committee report. In the interim, the board members, the secretaries themselves, and not the representatives, should be present, so that your response time and the coordination and the synergy is one in buo. Ika nga. Again, for transparency, dahil mas marami ang involved na mga secretaries, and of course accountability. In that sense. So if you believe it's helpful, and we appreciate that, and we hope to be able to see that and that it be implemented.
I
Dito naman,
strongly support that, Mr. Senator, Your Honor.
go ahead. Yes, thank you. Balikan ko lang ho yung nabanggit nyo kanina on the aggressive contact tracing, kasi nabanggit po sa mga tanong ni Senator Dillon. 2 weeks ago, sabi po ni Mayor Magalong, of the 600 plus LGUs that responded to his email regarding contact tracing, only 0.6% had the capacity to do contact tracing. And that's only 600 of the over 1,700 plus or 1,700 plus local governments. Where are we now after 2 weeks? Sabi nyo, aggressive contact tracing. How do you jump from 0.6% of your LGUs being able to do contact tracing to be able to address itong challenges ng contact tracing?
Salamat po. Sa tulong po ng Department of Interior and Local Government, which is by the way the lead agency for organizing contact tracing teams, meron na po tayong 134,686 contact tracers as of latest report. And as of August 15 this year, nakapag-trace at nakapag-assess po tayo ng mga 381,993 close contacts ng 88,000 more or less na mga confirmed cases. Ito po yung mga...
Sorry, Secretary. You're giving me different numbers. My question is about the LGUs, because my understanding is he is the contact tracing SAR, and as LGU, sabi niya, LGUs will play a critical role, and even the IATF is already going to download or going to decentralize. So if it's 0.6% 2 weeks ago or 3 weeks ago, what is it now? If you don't have the numbers, Secretary, we'd like to have it, because ang understanding ko, siya ang contact tracing SAR, yung kanyang benchmark, LGU participation, at yung sinabi niya 2 weeks ago, 0.6% lang ng LGUs ang may capacity. So I am assuming that he is going to work towards reaching a level of LGU participation definitely much larger than 0.6%. So that's the numbers that I'd like to have. If you don't have it now, Secretary, if you can submit it to the committee, because I'd like to see how we move forward in terms of contact tracing based on the benchmarks that that Mayor Magalong has laid down. So I hope you understand. That's the figure. Those are the figures that I'm looking at. Anyway,
Yes, Your Honor. We will look into this because this figure, in all honesty, this is my first time to come across a very low 0.6 of the LGUs or barangays that have the capacity. So the 0.6 is something that I want to look into very closely.
Yes, because in the overall scheme of things, kahit meron kang napakaraming testing, kung wala ka namang contact tracing, edi ganun din. Which brings me to the second point. There were discussions earlier about perhaps, our numbers, no, infection rates, etc. Tama po ba na the cases reported in the first 2 weeks of August are already more than the number of cases in July?
That's right. Our cases have gone up.
Yes. In other words, and I go to the point of Senator Dillon, unless we are able to bring down those numbers, Ang nangyari po kasi, hindi pa, kalahati pa lang ang August, pero mas marami na ang numero ng reported cases sa buong July. In other words, lumalaki. And until bumaba yung numero, di ba? Wala tayong kumpiyansang lumabas, wala tayong kumpiyansang mag-invest, wala tayong kumpiyansang ma-reopen man ang economy, ay hindi pa rin lalabas ang tao at apektado tayong lahat. Kaya ang sense ko dito is, my fear is, if the next 2 weeks of August will mean, kasi parang lumalabas from March to July, mas marami na yung August sa buong March to July. So palaki ng palaki. No? Yun ang concern natin. And that's why contact tracing is critical. More testing is critical so that we can treat those we have been able to identify. Doon naman po sa, actually, ito naman po sa, sa iba na ho ang tatanungin ko kay yung DOF rep sa inyong board. Who is this again? The rep of the Department of Finance, the representative?
Yes, Your Honor. I'm Sharon Almanzo of the Bureau of Treasury.
Yes, from the Bureau of Treasury. There is a call, I believe, from the House of Representatives, si Congresswoman Stella Kimbo, calling for a independent third-party actuarial validation. Kasi iba-iba yung sinasabi ng inyong mga kinatawan, no? Iba't ibang kinatawan. Yung isa nagsabi hanggang 2022 na lang. Yung isa naman nagsabi, hindi, marami tayong pondo, etc., etc. So, would you support, as the chairperson of the audit committee, as well as representative of the DOF in the board, do you support the call to have an independent third-party actuarial validation?
Yes, Your Honor. As a matter of fact, the Department of Finance instructed or directed the Insurance Commission to have an assessment of the actuarial projection as well as the model, all the assumptions on both collection and benefit expense. And I think there's already a MOA entered by IC and Philhealth in this regard, Your Honor.
Okay, so we're on our way there, in other words, to have a third-party actuarial validation. Is that right? Is she there? Nawala. On the matter of doctors' releases, I think the Senate President mentioned this earlier. I just wanted it clarified. They are the frontliners. They have been on 24 hours, if not even more, work. But there have been complaints of either delay in releases or a reduction in their fees or nabawasan. Hindi lang nade-delay, nabawasan pa. Can someone from the Philhealth respond to this question?
Mr. Chair,
Yes.
this is Dr. Vargas po.
Yes, go ahead.
The payment for the professionals are included po in the payment that we provide to the facilities as part of the release. It is the hospital who will now give this fees to the professionals. With regard to issue na nababawasan po, Mr. Chair, again, we pay po through fixed case rates. So, yun po yung ating pamamaraan ng pagbabayad.
Okay. Of course, pag delayed yung
Just on that, Francis.
Yes, go ahead, Mr. Senate President.
Sabi niyo, nasa bayad na sa binibigay niyo sa ospital.
Yes.
Kasama na doon yung doctor's fees, di ba? Yung paano yung mga ospital na hindi niyo binibigay pa?
Wala.
Yun po yung pinaprocess natin At kung meron po mga ospital na hindi pa po nababayadan, then technically po, yung sa mga doktor, hindi pa rin po natin nababayadan. Yes.
Yun ang sinasabi nila. Anyway, go ahead, Senator Pangilinan.
Yes.
You have an extension of 2 minutes.
Yes.
Go ahead.
Thank you. Yes, precisely. And I'd like to thank the Senate President for that observation. Eto sila, nasa front lines, tinataya ang buhay nila. Tapos dahil delayed yung pag-release sa ospital, delayed din yung pag-release sa mga doktor. The least we can do is support our frontliners, putting our money where our mouth is sa Philhealth and ensure na itong mga delay na ito ay tapos nauuna yung mga hindi naman COVID-related. Kaya nga, well, nabanggit na yun. No? We've done that. We've discussed that already. Just one more, two more questions. Nandito pa ba si Colonel Laborte?
Yes, he's
Yes.
present.
Yes, sabi po ni Colonel Laborte kahapon, nung huling hearing last week, sabi niya, napansin niya, laging iisa lang ang paulit-ulit na nanalo. Tama po ba yun, Colonel Laborte?
Mr. President, Senator Kiko, sir, good afternoon po. Yes, sir. Apo.
Sino yung laging nananalo? Usually yan, siguro 2 o 3 paulit-ulit lang umiikot kung mayroong collusion.
Nandito po sa listahan.
Yeah, can you mention them, place them on record? Sino yung paulit-ulit na nananalo? Pangalan ng kanilang. Kasi nabanggit mo rin, hindi ba, na 99% konti na lang, piso na lang o 1,000 na lang ang layo dun sa authorized yung ABC, di ba? Masyado namang malapit sa, di ba?
Tama po.
Oh, tsaka, okay, so sino yung mga yun? Can we have the names?
He is scrolling his phone.
Senator, Mr. President, Senator, Your Honor, Senator Pangilinan.
Yes.
Susugan ko lang po, bilisan ko lang po, susugan ko yung sinabi nyo tungkol din sa mga healthcare workers. Tama pa yung sinabi nyo. Sila nagbubuhis ng kanilang buhay at dapat talaga ay bigyan sila ng prioridad ng gobyerno pagdating sa early release ng hazard pay. At gusto ko pong ibalita sa inyo na meron po tayong binibigay na 100,000 pesos sa kada healthcare worker na nagkakaroon po ng COVID infection. At under Bayanihan 2, meron po tayong karagdagan 15,000 for every healthcare worker na magkakaroon po ng mild infection. Yung 100,000 po for severe and critical infection on top of full coverage by Philhealth for their cost of hospitalization. At para naman doon sa mga, sana naman, hindi naman pumanaw, pero minsan hindi po talaga maiwasan, 1 million po ang pinabibigay ni Pangulong Duterte sa mga pamilya, yung mga naiwan po. So, we're working on it, Your Honor, to really be more responsive and to really show to our healthcare workers how much the government is prioritizing them. Thank you po.
Bakit sinasabi hindi nyo na ibibigay yung 15,000? Doon sa mga cases.
Yung pong 15,000 ay ilalabas pa lang po yan kasi sa Bayanihan 2 makakasama po ito. Pero yung 100,000 po kasama sa Bayanihan 1 at saka yung 1 million pesos po para doon naman sa mga pumanaw ang kanilang mga kapamilya in line of duty. At dadagdagan pa ho natin to, yung travel, yung life insurance, yung accommodation. So we're working towards this, Your Honor.
So we know about that. Kami naglagay nun 1 million pagka matay at 100,000 pagka positive o serious case. Anyway, Colonel Labolte, are you ready?
Yes, Mr. President po. The following suppliers are always with it, sir. Number 1, sir, yung Trends and Technologies Inc. Number 2 po, yung NTT Data Philippines Incorporated. Number 3 po is yung Radenta Technologies, and yung Sun Solutions Philippines Inc.
So apat na paikot-ikot lang ang mga nananalo sa bidding. Tama po ba yun?
At tama po, sir. And nagpapalit-palit din po siguro ito ng pangalan, sir. Because,
Yeah.
notice since
Makikita naman sa bid documents yun eh. Tsaka yung apat na yun, ikot-ikot, pare-pareho rin. Halos 99% ang kanyang accuracy. Tama ba yun?
Opo, sir, they always won the bid price, which is 99% of the ABC, sir. And always, ano to, sir, awarded a single calculated bid, sir. Most of them.
Yeah. Tapos sinabi, and this is just one or two more questions, Mr. President.
Before you do that, Senator Pangilinan, we just like to direct the Secretariat to ask the SEC to submit the documents regarding these four companies.
Yes, yes, thank you, Mr. Senate President. Doon sa nabanggit ni General De Villa nung kayo'y nagkakausap, dinala mo daw, Colonel Laborte, yung mga dala-dala mo mga kontrata kasi pinag-aaralan mo. Tama ba yan? You had the contract documents and you were reviewing them. Is that correct?
Yes, sir. Yung mga outstanding contract for signature or for approval.
Yes. Yes. Would you have a rough estimate, Colonel, magkano ang money involved sa mga kontratang ito? I mean, what does it run to?
Sir, a single contract, sir, may go up to 40 million, sir.
So, mga ilan yung hawak-hawak mong kontrata? Total. Yung magkano yung involved dun sa nakita mong masyadong malapit sa ABC, pare-pareho nanalo. Ano yung total nun? Just to give us a sense.
Opo, sir. For 2018 tsaka 2019, sir, implemented na po ito, sir. Completed na po. So, it's about, may listahan po dito, sir. Sir, sa 2018 po. Ito po, sir. 2018, sir, about that, sir. Wala pong sum, sir. Wala pong total. Pero I'll find out muna, sir, dito sa kabilang document.
May kalahating billion ba?
Sa 2018, sir, over 500. Half a billion, sir, over.
Over half a billion. 2019?
It's about less than 300 million, sir.
So all in all, the last 2 years, mga 800 plus million worth of contracts yan.
Opposite, about 800 to 1.1 billion, sir.
Worth of contracts.
Opo, sir, yung complete.
Na ganun nga yung pattern, maliit, ganun. Kaya yun yung dahilan at nabanggit mo nga na hindi mo na makonsensya yung mga palakad. Tama ba yun?
Yes, sir. But po, sir. But may iba pa po. Yung IRM din po, sir.
Oo, iba pa yun. Pero kasama yun.
Kasama po, sir.
Yes. Well, Mr. President, I'll just raise questions if there's a second round. But I'm done for now. Thank you, Mr. Senate President. Salamat sa mga kasagutan.
Thank you, Senator Pangilinan. Next, we have Senator Grace Poe. 10 minutes, Senator Grace Poe.
Yes, magandang hapon po, Mr. Senate President at sa ating mga kasamahan. Ito po ay una kong katanungan kay Secretary Duque. Secretary Duque? Nadidinig po ba ninyo ako?
Yan po, Your Honor, nadidinig ko na po kayo. Maraming salamat.
Okay. Salamat po. Secretary Duque, doktor po kayo, hindi po ba?
Tama po kayo, ma'am.
At hindi lamang po doktor, kundi administrador din.
Tama po kayo, ma'am.
Bilang isang doktor, pag may nakita kayong sa pasyente ninyo, isang simptoma, halimbawa, may nakikita kang hindi tama o kaya may bukol, hindi ba mas lalo mong kikilatisin at iimbestigahan?
Tama po kayo, Your Honor.
At pag nakita naman ninyo na maaaring makasama ito sa kalaunan, ay agad ninyong susugpuin, hindi ba?
Tama po kayo, Your Honor.
Gamot o kaya operahan nyo para matanggal.
Tama po, bilang isang doktor po, dapat po yun ang gagawin.
Pero alam niyo po, parang ang sakit na nararanasan ngayon ng Philhealth ay isang cancer na. Dahil paulit-ulit po itong nangyayari noon pa. At ang masasabi lamang natin, kung merong isang tao na may institutional knowledge ng Philhealth, kung ibabase natin sa haba ng paninilbihan bilang isang pinuno, kayo po yun. Sapagkat ilang taon po kayo sa Philhealth bilang chairman or president?
Bilang president from 2001 to 2005 and then as chairman po from 2005 to 2010. Tapos itong nabalik ako noong 2017, Your Honor.
So masasabi natin na halos 11 taon kayong naninilbihan sa Philhealth.
As chairman and president po.
Kaya nga, so sa tagal ng panahon po na yon, ang masasabi lang natin, paulit-ulit ninyong binabanggit na kayo ay may krusada laban sa korupsyon. Subalit, parang taliwas ito sa mga napapakita ninyo at sasabihin ko kung bakit. Yung isang article dito sa Inquirer, sinasabi na 4,357 administrative cases since that was submitted in 2018. Not one was actually acted upon. Can you comment on this?
Yung po kasing, ano pong taon nito, ma'am? Anong taon nito?
Basta 2018 ang nababanggit doon sa artikulo na yon.
Oho. Ma'am, yung pong governance scorecard na pinagawa po natin for PhilHealth, in-address po natin na yung turnaround time kasi nakaka-frustrate. Yung pong paglilitis ng mga kaso, parang sobrang napakatagal. Kanina po nabanggit ko yung 3,000 cases ng cataract fraudulent cases ay na-archive pa nga po. At nung bumalik ako, ang sabi ko, ilabas niyo ulit yung mga kaso na yan. Hindi naman pwedeng i-archive lang yan. So, isinama ko na po ito doon sa mga governance reform natin na yung turnaround time ng mga kaso ng administrative cases ng PhilHealth ay dapat they have to expedite to its logical conclusion. Each of these
Excuse me, Mr. Secretary. Okay, so that's your pronouncement now. Pero ito po ay kontra sa mga nagiging hakbang ninyo kasi ang bilis ninyong magpa-transfer ng mga sa pananaw ng iba ay hindi kaalyado, natatapon sa kung saan saang ibang rehiyon dahil hindi sang-ayon dun sa ibang polisiya ninyo. Ang bilis ninyong gumawa nun. Pero yung mga kaso at yung mga iba nun hindi naman komplikado. Kung kayo po ay may liderato na malakas, di ba idol naman ninyo ang Pangulo natin na mabilis mag-aksyon. Bakit hindi ninyo nagagawa yan sa PhilHealth? Are you bogged down with administrative cases? Di ba nag-civil service pa nga kayo? Mapunta na lang ako kay Mr. Adre, Dennis Adre. Mr. Adre, actually bago po kayo, no? Babalikan ko na lang muna kayo, Mr. Adre, maya-maya. Dito sa nabanggit ni Mr. Keith, nandyan ba si Attorney Keith?
Yes, ma'am.
Attorney Keith, sinabi ninyo na may masamang mafia sa PhilHealth. Ginamit ko yung term na masama kasi sinabi ni Dennis Adre sila daw yung mabubuting mafia, no? Pero dun sa mafia na yon, kung merong godfather, itinuturo ninyo na si Secretary Duque mismo ang godfather nito. Masasabi mo ba kung bakit? Ngayon na nandito siya sa ating pagdinig.
Yes, ma'am. Na may tuturing ko po na siya po yung godfather po ng mafia. So, ang dahilan po na marami po siya at marami po rin siyang mga
Inaprubahan niya.
ma'am, doon po sa sa interim reimbursement mechanism, ma'am.
Siya
po
mismo
yung-
nag-aproba? May
siya
pirma ba siya doon?
siya po yung chairman po, ma'am. As a chairman, meron pong due diligence po na gagawin ng isang chairman, ma'am. And considering that he is a doctor and mayroon siyang institutional knowledge sa pamamalakad sa Philhealth, sa unang tingin pa lang po makikita na po agad na siya ay maanomalya. Kumpara niyo po sa akin na 9 months lang sa Philhealth, nakikita ko na po na marami pong fraud and corruption sa Philhealth.
So parang sinasabi ninyo, aside from complicit activities, merong command responsibility dapat, di ba?
Meron po siyang command responsibility at halos, ma'am, lahat po ng mga members ng mafia, ma'am, ay mga halos siya po yung nag-approve ng appointments nila, ma'am.
Mga members ng ano po?
Ng mafia, ma'am, sa Philhealth.
Okay. So babalik ako. Maraming salamat, Attorney Keith.
Yes, ma'am.
So mabalik ako kay Secretary Duque. I think nagre-refresh yata. Secretary Duque, nawawala kayo online. Secretary, pag bumalik na lang si Secretary Duque, paki-alert na lang siguro. So, habang wala pa si Secretary Duque, dun muna ako kay Mr. Adre. Dennis Adre. Parang nawawala pareho.
Regional VP Adre.
Mr.
Opo.
President, yes. Mr. President, yes, Your Honor.
Okay.
Dennis Adler.
Thank you, Mr. President. Mr. Adre, nabanggit po ninyo na meron kang binanggit na Plan 5 million. Tama ba yung pagkarinig ko?
Tama po, Your Honor. Mr. President.
Kailan po kayo nag-umpisa sa PhilHealth?
Nag-start po ko sa PhilHealth 1998, Your Honor.
So yung Plan 5 million, kailan po yon at ano yon? Paki-explica po.
Yun pong Plan 5 million, ni-launch ni former President and CEO Dr. Duque noong eleksyon ng 2004. Noong pong may survey na the late FPJ ay nangunguna ng 5 million votes sa survey. Kaya po 5 million din ang cards na ipinamigay ng PhilHealth na libre. Kami po mga regional vice presidents ay ipinatawag sa isang pulong sa central office kung saan in-explain kung paano po ang distribution. At sa maalala ko po, kaya kami rin nagkaroon po ng konting hidwaan dahil nilinaw ko po kung bakit si dating Mayor Duterte, na noy Mayor po ng Davao, hindi niya pinabibigyan ng cards, ng PhilHealth cards. At ang tugon po niya, actually nagalit po siya dahil bakit daw isinulat ko at incriminating daw po yon. No, ang tugon ko po naman ay kung if there's nothing criminal about what we're doing, there's nothing incriminating about it. In fact, yun po ang unang dahilan ng pagkalugi ng PhilHealth. Yun po ang unang dahilan kung bakit natalo po ang PhilHealth for the unpaid premiums which CSO was supposed to pay. And that was the first time that the financial statements of PhilHealth had been window dressed. In fact, Your Honor, in one of the visits, in one of the meetings in Malacanang recently, no less than former Senior Vice President for Finance, Greg Rulloda, admitted during that meeting that financial statements had indeed been window dressed in the past several years. But it started during 2004 because they had to make up for the losses that were incurred for non-payment of premiums during the plan 5 million.
Salamat po sa paglilinaw niyan. Alam nyo, hindi lamang ito dahil konektado ito sa akin. Alam ito ni Senate President Soto yung napagdaanan noong 2004. Pero, yun nga ginagamit ang isang institusyon ng gobyerno para sa sariling layunin. Hindi naman yata tama yon, lalong-lalo na malapit na yung eleksyon nun. Baka ulit-ulitin yan at kahit hindi naman pinagplanuhan, basta nagbigay na lang ng mga card na gano'n para lamang masabi na para makalamang sila, di ba? Parang binibili mo na rin yung boto sa ganong klaseng paraan, hindi po ba?
Your Honor, ang amin pong pakiramdam ay ang Philhealth ay pag-aari ng lahat ng Pilipino regardless of political affiliation. Ang Philhealth ho ay a political organization. So kaya po nanindigan kami, pero yun pong mga nanindigan katulad ni ang nawala na pong si Manager Linda Laureta. Siya po ay dalaga pero ini-assign po siya sa Marawi. Ini-assign po siya. Doon po nagsimula din ang mga reassignment kapag hindi ka sumunod o kinwestiyon mo ang mga illegal na pinagagawa.
Tama.
Ilan po kami ang... Your Honor. Yes, Your Honor.
Narinig ko nga yun kanina Maraming salamat po, Mr. Adre. Alam mo, actually, hindi naman natin sinasabi na hindi ko alam yung record ninyo. Yun yung totoo, no? Pero ako yung nagpapasalamat na at least sa panahon na ito ay naglakas loob kayo na magsiwalat ng mga alam ninyo. Sa susunod ko naman na katanungan kay Secretary Duque, ngayon na nandito na ba si Secretary Duque? Secretary? Mukhang selective na nawawala. Hindi ba?
Yes, Your Honor. I can hear you now. Your Honor.
Thank you, Mr. Secretary. Noong 2016 po, ang Food and Drug Authority ay in-order yung suspension ng Doctors Pharmaceuticals Incorporated, DPI, na pagmamayari ng inyong pamilya dahil sa non-compliance with good manufacturing practices. Alam niyo po yun?
Narinig ko po yan nung last year in the Senate hearing, but I just would like to reiterate that I divested, sold my share in the Doctors Pharmaceutical Company in 2005.
Exactly, sir. Because you also mentioned that when you were appointed Health Secretary in 2017, DPI was still in business with the DOH. And in fact, you mentioned that your brother should stop bidding with the DOH because of possible conflict of interest. Am I correct? You raised that with your brother.
Yes, ma'am. Yes, Your Honor.
On the other hand, in 2019, a case was filed against you because of conflict of interest over the 6-year lease of your property by the Philhealth. And your reasoning then was Philhealth requested that you continue with that lease because they really need the facility. And you were saying that at that point, you weren't anymore part of your company's business. But in fact, records will show that you haven't really divested at the time that the lease was ongoing and you were head of Philhealth in 2017. Am I correct?
My recollection, Your Honor, is that when I signed the contract between Philhealth and when I was president of the university, which owns the property, I was out of government. I was in the Gupan, and 2017 I got appointed by President Duterte, and my understanding was that PhilHealth was looking for a new building to transfer.
But as soon as you assumed office, you haven't really divested yet at that point, right?
Yes, Your Honor, but
Okay.
I was
Well,
out
that's
of the.
okay. Thank you, Mr. Secretary. Mr. Secretary, since doktor po kayo, paki-explain na lang and please pardon my pronouncement if I don't pronounce it right. Let me give you an example of Midas fraud and abuse findings, apparently. And let me just make a note. A lot of the documents that were sent to the Senate were sent at the last minute. I think some of them were received just yesterday. And this is almost like dumping on us all of these voluminous papers. And at the last minute, we have to review each and every one of them. There's no, I think it's almost like uh, intentional that this is being done. But anyway, in the Midas fraud and abuse findings, when it comes to the debridement of eczematous skin, can you please explain to me what that is?
The debridement of
Debridement.
eczematous, yes, Your Honor, of eczematous skin means cleaning, sterilizing the affected area.
Okay. Did it come to your attention? The average kasi nationally, I'd say, would probably be, well, it ranges from 33 million to about 737,000. So, yung high is 33 million, yung low is 700,000. So, napakalaki ng agwat. And, yun pang pinakamalaking agwat ay sa iisang lugar. I'm not going to mention the name of the professional involved, okay? Because I think that I don't want to focus on a personality here, but the symptom of a larger institutional problem. So, in this one region, parang 50, parang lumalabas na 56 million ang ibinayad. One is for 33 million, another for 23 million. For 4 years lang. Isang ano lang yan, isang case lang yan. So kung talagang merong ano, yan, pwede na yan tignan. Tapos hindi lamang yon. Merong isang clinic na nag-submit ng fraudulent reimbursement claims noong 2018. The year before you were appointed. On average, their dialysis machines capacity was 100 to 133%. Pero, nung sinubmit yon, ito yung B. Bron Abitum. You still gave them 45.17 million under the IRM. May official receipt pa ito. So parang yung mga nagkakaroon ng kaso ay nabibigyan, I mean, let's not get into the detail of what their cases right now, but this is what I'm saying. They already have pending cases. They've been found to be doing something less than exemplary, and yet they continuously receive funding from the DOH. This is either negligence or malice. So what would it be in your case as chairman of the board?
Thank you, Your Honor. I would like this question because kung ano ito pardon me, with all due respect, yung very operational. Can I, because I don't have the details of this, can I just please refer to Philhealth Management to
That's
address
okay,
this?
because I will ask you to submit on record your answer to those cases.
Yes,
I think
we
that
will
would be
prepare.
better and that would be more efficient at this point because we have other topics to get to. Secretary Duque, sinabi niyo kanina no that you did your best, but your best wasn't good enough. Parang may karugtong na kanta to sa isang kanta, di ba? Pero tama ang karugtong nito. So here we are, back where we started. So, 11 years na po kayo dyan. Paulit-ulit lang yung nangyayari. Ano ang solusyon na naiiba ngayon na hindi ninyo nagawa noon? Alam niyo, marami nang humingi ng inyong pagbibitiw. Pero kayo mismo, hindi ninyo inakala na magbigay ng kortesiyang ganon. Sapagkat, tinan mo sabi mo nga, your best is not good enough. But you're continuing, you're still there in that agency. So how would you answer that?
Ang nasabi ko po, Madam Senator, is that if others think that you have not, that my best is not good enough, then that's their opinion, that's their judgment. What I was referring to was the others who, if they don't think that my best is good enough. Thank you.
Well, you know what, sir? I think the numbers will show that you have failed miserably as the lead of both PhilHealth and the DOH. Okay, so that may be my opinion, but I think that I'm in good company of not only the numbers who would believe in that, but also those that are actually knowledgeable in that field, particularly in the medical field. So, Mr. President, with what's happening today, I'm sure that there are already many, our colleagues have other questions to ask. But I think we've established that there is a cyclical pattern in the PhilHealth, and we really need more courageous individuals to come forward and validate all of these suspicions that we have, and in some cases, actually facts already. Mr. President, I know that there's a Whistleblowers Act that gives some sort of support for those that will call attention to fraudulent activities in government or corruption in government. But I would also like to explore the possibility that with the own funds, I don't know if this will be proper or legal, but perhaps we can explore how the Senate in itself, with our own budget, even if I know that we're all strapped for funding, but how can we help these who will come forward, if not scholarships for their children? I know that the Senate maintains an account, and it's led by a very reliable colleague of ours, Senator Lacson, who also heads, who knows about the intelligence fund of the Senate. Maybe we can use it in the future to incentivize those that will come forward. If not direct monetary contribution to them, maybe in terms of scholarships or other incentives. So that's all, Mr. President. Thank you.
Thank you, Senator Bo. We will look into the suggestion that you made. Thank you very much. Next, we have Senator
Bongo.
Okay.
Kaya na.
Mr. President? Ako ba or si Sen Bongo?
I'm sorry. Yes, they reminded me. Senator Go is next, and then we will have to call the majority. Is not ready, but he probably can do that after Senator Tiveros.
Nakikita eh.
Senator Subiri. So we'll go with
Thank you, Mr. President.
Tiveros and then Subiri. Senator Bongo.
Good afternoon, Mr. President. Napakarami na pong nating napag-usapan dito sa pagdinig na ito. Sa lahat ng ito, isa lang po ang malinaw sa akin, the public deserves to know the truth. Ngayon, higit kailanman, kailangan ng tao ng isang gobyernong malinis at maasahan. Mayroon po tayong task force na mag-iimbestiga sa mga anomalya sa PhilHealth. Ulitin ko, malinaw ang sinabi ng ating Pangulo, walang lugar ang korupsyon sa administrasyong ito. Talagang yayariin kayo ng Pangulo. Narinig ko na nag-file na po ng leaves of absence ang ilang regional senior officers. The government welcomes this development, pero hindi po nagtatapos dito. In fact, this is just the start. Yung mga iba pang sangkot pero hindi matinag at hindi nagpa-file ng leaves of absence nila, dapat ay i-preventive suspension na kung may basihan naman po. Dapat pilayan po ang mga magnanakaw para hindi na po makagalaw. Dapat ngayon na po. Kung pwede lang, putulin yung daliri. Ang layunin nito ay maging mas malalim at mas mabusisi ang investigasyon para ito sa bayan at para na rin po malaman natin ang katotohanan. Kung ang taong bayan po ay napapagod na sa mga narinig nilang walang pakundangang pagnanakaw sa kaban ng bayan ng mga tiwaling opisyal ng PhilHealth, napapagod na rin kami. dito sa Kongreso, pati na rin po ang Pangulo ay pagod na rin po. Anyway, sigurado po ako na napakarami pa rin empleyado sa PhilHealth ang nagtatrabaho ng mabuti at marangal, mas marami yan. Kahit kaliwat kanan ang pambabatikos ng publiko sa PhilHealth dahil sa pagnanakaw na ginagawa ng mataas na opisyal. Suggestion ko lang po sa Committee of the Whole natin dito, bakit hindi natin tanungin yung mga maliliit na empleyado sa baba, baka may maisiwalat sila o kaya may tutulong sila sa investigasyon natin dito. I have 2 questions lang po. To the GCG, kumusta naman po ang performance ng PhilHealth nitong mga nakaraang taon? Nag-improve ba sila at lalo bang lumala ang sitwasyon? Anong masasabi ninyo sa panukalang buwagin na lang ang PhilHealth at gumawa ng panibago at mas malakas na opisina para sa public health insurance? I'm addressing my question to the GCG.
Sa 2017, mababa yung scorecard nila. Same sa 2018. Tapos yung corporate governance scorecard, sa 2018 lalong bumaba. 43% na lang. So may problema talaga sa governance ng PhilHealth. With regards to buwagin siya, kailangan talaga may amendment yung PhilHealth law. Yung sinabi mo dati, yung nag-appear ka na sana yung quasi-judicial function ng PhilHealth tingnan para itong mga problema diretso na matugunan and wala ng collusion. Tama po yun, Your Honor, Senator Bongo, na baka yung quasi-judicial function ng PhilHealth dapat tingnan.
Salamat, Secretary Dagpin. I have another question for Attorney Rodolfo De Rosario.
Good afternoon, Senator Bongo.
There are reports that the PhilHealth refuses to implement or even outrightly ignores final decisions of the Supreme Court and the Court of Appeals on suspension of hospitals. Is this true? If so, what is your legal basis for this?
Thank you, Mr. President. I think you're referring to one decision by the PhilHealth Board pertaining to the perpetual SOCOR, Mr. President. The legal basis or the legal opinion on this matter was forwarded, decided even before I was designated as head of the legal sector, Mr. President. So the rationale based on my reading on the policy of the board is to pen the hearing provider, but at the same time allow the provider to continue deliver the services, health services to the PhilHealth members, Mr. President, Senator Bong.
Based on the records of PhilHealth, which, by the way, you are required to keep, how many health care providers or hospitals have been ordered suspended by the courts? How many of these orders have been implemented?
The enforcement of the decisions is with the regional offices, Mr. President. It is the arbitration office, a separate office not under my supervision, that issues the writ of execution. We will ask the concerned departments to submit the report, Mr. President.
Kindly. Another, yung iba pa daw, such in the case of Basilan Community Hospital, the PhilHealth Board canceled the 9-month suspension imposed by the Court of Appeals and instead retained the penalty of fine only, which was increased from 40,000 to 200,000. Again, totoo ba ito at ano pong legal basis nito?
Thank you, Mr. President. The same legal basis, the board resolution pertaining to the imposition of maximum fine instead of instead of a suspension. And if my memory serves me right, the decision of the board is anchored on the fact that that particular facility is the only level of that facility in that particular area, and the people will be disadvantaged if the suspension will push through for 9 months, Mr. President.
Then, big time collection scam involving Accenture was uncovered and reported by Philhealth Senior Manager for Treasury Evangeline Racelis 10 years ago. This scam involved the premium payments of the employees of Accenture Incorporated, which was paid through Metrobank. The payments never reached Philhealth but appeared as paid in the IT system. The head of the IT management division during the time was Rodolfo Del Rosario Jr. When the NBI investigated the scam and requested for access to the IT system of Philhealth, Del Rosario invoked data privacy and refused to give the data, which could have aided in ultimately solving the case. Is this true? Can you elaborate on this?
Definitely, Mr. President, that is not true. We have already submitted the records based on that case. I was assigned as OIC of that particular department on November 4, 2011. The discovery was made on December 5 by the Treasury Department. But that fraud was ongoing for the past 2 years, if I'm not mistaken. No? Parang every month po yun ginagawa. So the office, no, the corporation created a fact-finding committee and eventually an ad hoc committee that heard the case. Two of the officials or officers involved were already dismissed from the service, and there's no truth to that report, Mr. President, that I refused to provide the information since we were actually the one who cooperated with all the investigations. Thank you, Mr. President.
And then I have one specific question to SBP Management Services Sector, Dennis Mas.
Sir,
Are you around?
yes, sir, Mr. Senator. Ako po ito, si Dennis Mas.
The requirement for SBP legal department was 10 years of legal experience since the time when PhilHealth was reorganized. However, in 2018, it was alleged that you, as SVP Management Services Sector, changed the qualification standards and removed the 10-year requirement to be Chief of Legal Department. Why was this change implemented? Hindi ba noong time na yon nag-apply si Del Rosario for SVP ng legal pero hindi po siya qualified?
Hindi po yun na tama, Your Honors. Ang qualification standards talaga ng mga SVP sa PhilHealth ay generic. So 5 years na managerial experience. Meron kang master's degree at meron pang mga substitute na iba pang pwedeng consider. So based sa, nasi-screen ho kasi nito, Human Resource Department eh. Sila yung tumatayong secretariat sa Human Resource Personnel Selection Board for Executive and Managerial Officers ng PhilHealth. So ang basic requirements talaga ay hindi about lawyering, but 5 years managerial experience, yung pinaka-generic niya. So yan lang po yung ano. So as published, yan din yung ina-adapt ng PhilHealth. But yung management may opt to i-adjust yun later. Pero sa ngayon, yan lang ho talaga yung qualification standards na siniset sa lahat ng mga senior vice president position sa PhilHealth. Although ang civil service talaga nag-encourage na gagawin ang technical. Pero sa ngayon, wala pa doon yung PhilHealth honors.
Thank you, Mr. Dennis Mas. Anyway, Mr. President, according to Secretary Guevara, they will finish their investigation in 1 month time para makapagtrabaho na rin po muli yung PhilHealth, kawawa yung Pilipino, at ma-implement na rin po ang universal healthcare. Marami pong Pilipinong umaasa sa PhilHealth. Wala po silang ibang matakbuhan. Hindi, yung PhilHealth naman po ang nasa isipan nilang. Anyway, Senate President Soto, sana po ay pwede nating mindahan yung batas. Nabanggit ko kanina out of frustration. Pwedeng bawat mahuli ay putulan ng isang daliri. Kung maaari po, para matapos na rin po itong kalbaryo ng PhilHealth. Thank you, Mr. President. That's all.
Thank you. I wish I could agree with you, but it's unconstitutional for inhumane punishment. By the way, just to inform you, you amused me again last night because after your video on Facebook, you disappointed some people, I guess.
Yung daming haka-haka, daming fake news.
Sometimes you're very disappointing to some of them.
May panahon lang naman yan. Di antay na lang po yung panahon.
All right, thank you, Senator
Mr.
Go.
President,
Yes, Senator Lacson first before we.
Go ahead.
Attorney Kate.
Yes, sir.
give me way.
You have a question this morning, sir. How to fix the problem in PhilHealth, sir? And then we have been discussing this for a very long time, sir. I think if we want to really cut off 70% of the corruption in PhilHealth, sir, we should introduce the blockchain technology, sir. That is the first one, sir. Spread the risk, sir, because most of the members of those who are corrupt, sir, are very close, sir, and then the number is only few, sir, 8 of them, sir. We can spread the risk, sir, by putting additional people, sir, and then the data privacy law should be amended, sir, because they always use the data privacy law when I try to ask for documents, sir. They always use the data privacy law, sir. So the data privacy law should be amended, sir, to look into the penalties, sir, because it is also in violation of the Section 7 of Article 3 of the Bill of Rights, the right of the people to information, sir. That is what I have observed in the PhilHealth, sir. That's all, sir. Thank you very much.
There is a comment by Senator Lacson to that effect also. Senator Lacson.
Yes, actually, Mr. President, we are in receipt of a letter from the chairman of the Data Privacy Commission. Ang sinasabi doon sa sulat, I'm trying to get it now, to retrieve it now. Kami mga investigation, saka government agency, hindi sakop ng data privacy. Does Senior Vice President Dolisario know that?
I agree, Mr. President. If the investigation is conducted by a law enforcement agency, sir, so that's why we have forwarded
the
voluminous
NBI?
documents to the NBI.
To the NBI?
And
When?
to the Ombudsman, Your Honor.
When was this? When did you forward the document?
Starting June of 2019, Your Honor, we have been already forwarding documents. We can forward a copy of the transmittal letters.
Because I heard Secretary Roque being interviewed sa
Yes,
radio. Sabi niya, he was so frustrated because he was the one who filed the case against you. And then, nung kumukuha rin ng dokumento NBI, you didn't want to provide, and you invoke the Data Privacy Act.
I sir, may I respond, Mr.
Yes,
President? Secretary Harry Roque has never filed any complaint against me, Your Honor. It was against other officials. But
But he mentioned your name.
he mentioned my name
Yes.
because he was angry about the WellMed. He thought that we included the whistleblowers, that I was the one who was responsible in the inclusion of the whistleblowers. But there was a misunderstanding dahil wala naman po dun sa unang affidavit yung mga whistleblowers. The original affidavit of our investigators did not include the whistleblowers. Dahil ang sabi ko po, it's not good policy to include the whistleblowers. But anyways, Mr. President, regarding the request of Secretary Harry Roque to the documents pertaining to the WellMed investigation, The decision then, I took a leave of absence na po noon eh. But ang nasundan ko po noon, the decision was to refer that to the National Data Privacy Commission for the reason that the secretary was no longer connected with the government during that time. And that all those documents actually were already forwarded to the National Bureau of Investigation. Mr.
I
President.
beg the indulgence of our colleagues. Very, very quickly lang, again, kay Atty. Del Rosario. When did Circular 2020-0007 actually take effect? Ano yung date of effectivity?
I'm not familiar with the
No, it's in the circular. Kindly read chapter 8.
Of circular on COVID po ba yan, sir?
No, Circular 0007, yung 2020. Circular on IRM. The latest circular on IRM. Ako nababasa, chapter 8, date of effectivity.
Thank you, Mr. President.
Okay. The circular shall take effect from its publication in a newspaper of general circulation. And 3 certified true copies had been furnished the Office of National Administrative Register, ONAR, of the UP Law Center. Now, ngayon ko lang natanggap yung, kasi I requested ONAR. Nakatanggap po ako ng sagot sa kanila. Ngayon lang, August 18. Ang date nito, filed on June 11. So yung IRM ninyo, Circular 2020-0007, hindi po effective until June 11. Ang karugtong na tanong, ilan na ba yun na-disperse yung advance payments between March 21 or one day after March 20 when it was signed by General Morales and June 10, a day before it took effect? Marami na, di ba? Billion.
Yes, sir. Almost siguro baka pinaka
So
majority of
what
the
will you make of that? Lahat ng releases. Ibig sabihin, wala effectivity pa yung circular, nag-release ka ng pera, lahat yung illegal. Is that a correct statement?
It did not satisfy the requirement of the circular,
Yes,
Mr.
yes.
President.
Yes. Thank you, Mr. President.
All right, Senator Lacson. Yes, thank you. Next is Senator Hontiveros. You have 10 minutes.
Thank you, Mr. President.
Mr. President, may I just point of order, Mr. President? When will I be recognized in the list? Just a question.
After Senator Hontiveros, because we made a mistake earlier recognizing.
Okay.
So
no worries.
Right.
We'll wait. Ladies first, definitely. Thank you.
Salamat, Mr. President. Salamat, Majo. Mr. President, gaya po ng sinabi ni Senator Frank kanina, Minority Leader, kahapon pumalo na ng 164,474 ang bilang ng mga Pilipinong may COVID. At mukhang ginawang gatasan ng iilan ang institusyon na dapat pinagmumulan ng kumpiyansa at kalinga ng mga kababayan nating may sakit. Isang mahalagang haligi o pillar ng universal healthcare ang isang matatag na health financing system. Now more than ever, we need to preserve the gains of universal healthcare, protect health funds, and ensure people have a lifeline during these uncertain times. Pero kahapon lang ay nag-file ng official leave ang 6 na regional vice presidents ng ahensya. Pagkatapos ng 6 regional VPs, ay nag-file o magfa-file din ng official leave ang buong execom ng Philhealth. Kung lahat na sila nag-leave of absence, sino pa ang mga natitirang nagpapatakbo ng ahensya? Isang concern na in-air din kanina ni Senate President Pro Tempore, Senator Ralph. Naintindihan ko po, Mr. President, na kailangang iwasan ang undue influence sa ongoing congressional inquiries. Pero dapat nating siguruhin hindi pilay ang Philhealth sa pagtupad sa kanyang mandato sa publiko. Lalo na nga ngayong may kinakaharap tayong napakalaking health crisis. Yung pagli-leave ng mga opisyal ay hindi dapat makaapekto sa day-to-day operations ng ahensya. I thank the chair for inviting Secretary Duque to today's hearing. Dahil parang sa gitna ng kaliwat ka ng alegasyon ng korupsyon, parang iniwan ng nasa liderato ng Philhealth ang kanyang mga rank and file and frontline employees. Alam ko po, Mr. President, na marami sa mga empleyado ng Philhealth ay tapat, masipag, at may prinsipyo. Alam ko ring kasama natin sila sa paghangad ng isang mas malinis na ahensya. Sa gitna ng pandemya, sila rin ay maituturing na frontliners. And this is why I feel that PhilHealth's leadership has failed them. It's for them and for the public they serve that we want to get to the bottom of the issue. So, Secretary Duque, mga tanong ko po para sa inyo. Earlier, Senator Grace already asked, and I recall during the August 2019 hearing, and again this morning, SVP Dennis Adre testified that, and I quote, "We were ordered by then PhilHealth President Dr. Duque to distribute free PhilHealth ID cards, 5 million of which corresponded to the 5 million lamang of FPJ over former President, GMA, etc." So, Sec Duque, do you now confirm this event?
I deny strongly said allegation, Your Honor.
Mr. President, that's really regrettable kasi parang nagmumukhang pinasisinungalingan yung sinabi ni Sen. Grace kanina at yung sinasabi ko ngayon. But I will not belabor that issue since the Secretary insists on denying this event, Mr. President.
Your question was, is it true that they distributed 5 billion health cards?
Yes, Mr. President, I was asking the good Secretary to now confirm this event. But he has denied this event.
What was
Further,
Excuse me.
If I may
I'm sorry.
proceed,
I'm
Mr.
sorry.
President.
Excuse me. The 5 million, not in connection with the allegations of Mr. Dennis Adre, but the 5 million was distributed based on the executive order then of President GMA. And so there is no correlation between the PhilHealth program and the elections. Cases were filed against us and they were all dismissed by Ombudsman Morales.
Well, Mr. President, Sec Duque. Yes, Mr. President.
There was a pending case with Comelec. Former DepSec Marie Ramal filed a case against you concerning this. What
That
happened?
is true, Mr. President. Mr. President, that's true. But that was also dismissed, Your Honors.
Well, Mr. Secretary, I was not in relation to the case filed in the Ombudsman. I was not asking about the legality or the propriety of the PhilHealth card distribution using OWA funds. I was asking you about the simple correctness or not of SVP Dennis Adre in saying that he was ordered to do so. And I need to ask you a follow-up question about that, Sec Duque. Further, SVP Adre said, and again I quote from the transcript of last year's hearing, and he referred to it again this morning, quote, "And so we resisted, and that was my first taste of reassignment, Your Honor, or an attempted reassignment for that matter." So, Sec Duque, totoo po ba na ni-reassign ninyo sila dahil nag-resist silang sumunod sa gusto ninyo?
Your Honors, that couldn't be the reason why he was reassigned. I have to look into the records. It's been quite some time. I'm sorry, but I will look into the record.
Well, I will appreciate that, Sec Duque. Pero itong dalawang itinanong ko sa inyong basic facts about the incident, kung sinasabi nyo na hindi totoo yon, hindi totoo yung pagre-reassign ninyo sa kanila dahil doon, but what reason would SVP Adre have to make such accusations against you? Why would he make such statements?
I really do not know, Your Honor, why they're making up this. But anyway, the important thing is we look into the records and the cases that have been filed and dismissed.
In that case, Mr. President, in terms of looking into the records, may I go briefly to SVP Adre to confirm or to shed a different light dito po sa mga tanong ko kay Sec Duque. SVP Adre, are you here online?
Good afternoon, Senate President and Madam Senator. This is Dennis Adre.
Yes, mainam po, SVP Adre. Can you please tell me what you know about the two events that I have asked of Sec Duque, that you said he ordered you to distribute the free Philhealth cards, and further that, following on that you resisted, and that was your first taste of reassignment.
Let me correct first the fact of reassignment. It was an attempted reassignment.
Yes.
Those who were reassigned were the other two managers. Now, one manager and one regional vice president. One manager was assigned to Marawi, a lady manager of corporate communications. Her salary grade was that of a manager, but she was put in an office that was just a local health insurance office in Marawi. And had it not been for the session of Regional Vice President Makabato, then she would have stayed in Marawi longer, but she was transferred to Iligan City. At any rate, another regional vice president who also questioned the plan 5 million because it was, when it was presented to us, it was a meeting among all regional vice presidents, and I assure you, ma'am, that all regional vice presidents during that time can attest to the fact that he called this meeting where he even presented to us a table of the breakdown of the 5 million among different provinces. And one of the specific instances that I recall was the instruction not to give then Mayor Duterte his share of the card because Mayor Duterte does not belong to their party.
So you're confirming to this committee of the whole, SVP Adre, that in that particular case of the order to distribute the free Philhealth cards using OWA funds, na may dalawang opisyal na dahil katulad ninyo tumutol ay na-reassign. Thank you, SVP Adre. Sec Duque, I'd like to ask you something else. Also in the August 2019 hearing, you were quoted as saying, and I quote, "You have standards of cesarean section, dapat 1 in 4 lang." And then you have a certain region that reports 3 out of 4 cesarean sections. So dapat i-flag mo na yon, sugurin mo na yon. My question, Sec Duque, is what region was that? At sino ulit yung SVP doon? Sec Duque, naka-mute kayo.
I'm sorry. I'm sorry, I said, because I don't have the data right now, but I will get to it and get back to you as soon as possible.
Thank you, Sec. But when you raised that observation last year, it was alarming enough. Were you concerned enough to investigate?
I think I have mentioned to the management to investigate all these outliers. It's part of the outliers that we were able to call out from the data analytics, the machine learning information data analytics, or MIDAS. So I will look into this, Your Honor, and look at the data more closely.
I hope you will also get back to the Committee of the Whole, Sec Duque, what investigation you actually were concerned enough to initiate, at ano po yung findings nun, kung aling region ba yon, sino yung SVP, and what disciplinary action, if any, was taken in this case. Because alam nyo naman po siguro, Sec Duque, also as a doctor, this cesarean quote-unquote scam, no, would be particularly galling to me as a women's advocate. Di lang kasi ito usapin ng pagkita ng pera, pero unnecessary cesareans actually put women in greater danger. For example, according to a study in the Lancet, deaths from cesarean sections are 100 times higher in developing countries like ours. My understanding of the quote-unquote scam, if that's what it was, is that doctors upcase regular deliveries to cesareans because the case rate is higher. And because doing CS is faster, no? Hindi na kailangan maghintay ng labor, onset of labor. So you can actually do more deliveries in one day, but it is imminently more dangerous to women. So I hope the good secretary will furnish this committee of the whole with statistical data on cesarean operations in hospitals in the country in general. Kung pwede, Sec, isama nyo na iyon.
We'll do that, Your Honor. We'll do that. But let me just add that the MIDAS reports we have submitted to the NBI, being the agency with the mandate to investigate. But I will give you the records, Your Honor.
Salamat, Sec Duque. That's an issue from last year's hearing. Pero hindi kaya, Sec Duque, na medyo nakaka-hands-off din kayo sa mga fresh allegations ngayon? Like in the last 2 weeks before, I'm so glad you came before us today. Hindi kaya nakaka-hands-off kayo dyan sa mga fresh allegations dahil si Attorney Del Rosario ang nakapirma sa lease contract sa pagitan ng Philhealth at EMDC, kung saan hindi kayo kundi yung kapatid ninyo ang other party.
What is the question, Your Honor?
I'm just wondering, Sec Duque, although I'm relieved that we have you finally here with us today, yung pananahimik nyo the past half month, hindi kaya naka-hands off kayo sa kahit sa gitna nitong maraming fresh allegations? Dahil, for example, in a previous incident in between Philhealth and EMDC, hindi naman kayo yung signatory with kundi yung kapatid ninyo. And it was not you for Philhealth, pero si Attorney Del Rosario nakapirma sa lease contract. And on the other side, on the side of EMDC, yung kapatid ninyo.
Ito po kasing issue na ito I addressed fully last year. This is not a fresh issue.
Exactly.
This is an issue raised last year. My having been quiet, if that is your view, is really,
Yes.
is really because I've been very busy on the ground, coaching and hand-holding several LGUs up to the barangay levels with their pandemic response. Because, you know, this is a very difficult problem of the COVID-19, and we really need to coach, we really need to show the way, and that is why we put together the IATF NTF code team. Code means coordinated
Actually, Sec
operation.
Duque, sorry to interject, but I have my own very opposite view about that recent step you have taken under IATF sa mga LGUs natin. Pero gayon pa man, no, kahit na sinasabi nyo you were on the ground, kayo pa rin ang Secretary of Health. Dapat chair ng IATF. In fact, lead sa anti-COVID-19 response and making sure as chair of the board of PhilHealth na yung pillar na yon ng ating universal healthcare system remains unassailed rather than binabayo ng napakaraming allegations sa ngayon. In any case, Sec Duque, since I just have a few minutes left, one last question, no, about the current issues that have been begging for an answer, clarification from you from the last 2 weeks. Sec Duque, sabi po ni Attorney Keith, kayo daw yung godfather ng mafia. Do you have a reaction to that?
I deny this. Absolutely malicious and without basis. I do not wish to dignify that allegation.
All right. Sec Duque, panghuli. Well, yaman din lamang nandito na rin kayo, no? I need to ask you about the Department Memorandum number 2020-0285, suspending the special risk allowance for frontliners. This was actually brought to my attention by a DOH nurse who is now COVID positive. Wala pa silang SRA ngayon, hanggang ngayon, dahil sinuspend ng opisina nyo. So this is the memorandum, and this is an urgent query, Sec Duque. I hope you can do something about it. Sumabay pa po dito sa memorandum na ito, Sec Duque, yung balita na the Philippine government again bans medical workers and allied health professionals from leaving the country during our state of national emergency due to COVID-19. So talagang hands on deck sila dito at dito lamang, and yet nasuspend yung special risk allowance. I would like this to be my last point, Sec Duque, Mr. Chair, dahil hindi naman tayo nandito na nag-uungkat para lang for the sake of mag-ungkat. No, we're conducting this investigation because people are literally dying and falling sick on a daily basis at para po ito sa kanila. So Sec Duque, please, is there urgent action you can take about this?
Yes, ma'am. I will certainly address this expeditiously, and it's not clear to me why this was suspended by USEC Roger Tong-an, but I'll meet with
Sec,
you.
it's your office of the secretary, letterhead. I'm sorry.
Yes, ma'am. What was that? Sorry.
Yes. Well, letterhead po ninyo, Office of the Secretary. And pumirma, yes, si Yusek Tong-an, but by authority of the Secretary of Health. Kaya sa inyo ko po dinadala ito for urgent action on behalf of our frontliners na dapat lang naman siguro no, may special risk allowance now that they are bearing additional risk even compared to their usual risk every day.
Yes, Senator. Yes, Your Honor. I will address this. Even now, I'm gonna make the urgent call to address this.
Could your urgent call be to revoke the memorandum, Secretary? The nurse who brought this to my attention already has COVID, contracted from when she has been on duty taking care of us Filipinos sa gitna ng pandemic. Could you please revoke this Department Memorandum Order 2020-0285?
Can you give me just an hour until the action to revoke it is done? An
And then,
hour.
yes, please, Secretary, and then please update all of us here in the Committee of the Whole. And I really hope your news for us within
Mawala po
an
kayo.
hour will be positive for our frontliners, including that nurse.
Yes, ma'am. I will attend to this immediately.
Salamat, Secretary. Salamat, Mr. President.
I thank you, Senator Ontiveros. With the indulgence of Senator Subiri, there are two other regional vice presidents who are online and just want to make a statement. I was told, so it's them. They have been here since early this morning. Regional Vice President Makabato, are you there? With the indulgence of Senator Subiri, there are two other regional vice presidents who are online. You're online. Maybe you know who are the other regional vice presidents who are online? Regional.
Hello. Hello.
Alonto.
Yung Galitaan.
And Chavez, I suppose. There are three of you. Regional Vice President Makubato, you wish to make a statement? Regarding an issue brought up by Senator Nicolas?
Mr. President. President, referring to that alleged meeting brought out by Mr. John Fadre, an alleged meeting in 2004. Would you like to comment on that alleged meeting in the year 2004? Kung meron kayo alam.
Go ahead, Mr. Makabato. Go ahead.
Brought out by would you like to that alleged meeting in the year 2004? Meron kayo alam.
Go ahead. You're muted right now. There you go. Go ahead.
Hello.
Hear you. Go ahead.
Hello. Can you hear me? Hello.
Yes, we can hear you. Go ahead.
Yeah. Assalamualaikum warahmatullahi taala wabarakatuh. I would just like to clear my name because the last time that we have this Senate hearing, my name was mentioned as one of the mafia, although later on it was because of our refusal to be reassigned. I would like to put into record that there are only two instances where I was reassigned. The first one was in 2010, where there was uh, the order was issued during the onset of the election ban. So I was afraid that I might be accused or I must be implicated with possible election cases in the region where I was supposed um, to be transferred. So I went to court, asked the court to stop my reassignment, and accordingly, a order or injunction, permanent injunction was issued by the Regional Trial Court of Marawi.
When was this?
This was in 2010. And the reason why we were reassigned was because as already of the incident that was already articulated by RBP Adre when we refused to heed the implementation of the uh, um, another scheme which is very similar to the IRM. And in fact, there was a threat before we were transferred. There was a threat that was cursed through RBP Adre that if we will not agree with the implementation of the policy, they are going to transfer us. And the second instance was um, during the time of Roy Ferrer. Again, we were again reassigned because of the differences in policy. Then we were also perceived to be one who employs the CA to reject the appointment of then Secretary Obial. And it was it was very amazing for us, an ordinary officer of Philhealth, to employ the CA. That is why we were reassigned. But again, I question this because it did not pass through the process. Because had they consulted me, Mr. Senator, Mr. President, in that hearing last year, I stated that I am a cancer patient, and had they consulted me, then my reassignment would not be pursued because I am I am a cancer patient and a victim of the Marawi seeds, po,
Okay.
Mr. President.
Thank you, RV Regional or RD Makubato. Yes, Senator Zubiri, you have 10 minutes.
Thank you very much. Thank you very much, Mr. President. Thank you very much to my dear colleagues. Mr. President, I'd like to direct my questions initially to Secretary Duque, if he's still online. He was listening, but
Yes.
Secretary Duque, are you still online? Yes, good afternoon, Secretary.
Yes, can you hear me now, Senator?
Yes,
Okay,
we can.
thank you.
Thank you, Secretary. Secretary, I'm just going to ask two policy questions. These are two policy questions. On the issue on funding for hospitals, you're very familiar, Secretary, on the success on the Bukidnon Provincial Health Indigency Program. As a matter of fact, I believe you were Philhealth when we were awarded as one of the top health centers in Mindanao, because we were one of the first, Mr. Secretary, if you can recall, that did the no balance billing utilizing the provincial funds. We built 5 hospitals all over Bukidnon, North, Central, and Southern Bukidnon. and we were able to come up with a no balance billing system. We hired our own doctors. We put state of the art equipment. In other words, the focus then of the provincial government was to treat the problem of health, no, in health problems of our people of Bukidnon. Now, the situation is here now with PhilHealth. It's expanded all over the Philippines, but unfortunately, there are many accusations of fraud and leakages leaving the PhilHealth coffers. I actually, in the last hearing, Mr. Secretary, had uncovered about 5 different schemes of leakages or fraudulent schemes, no, which defraud PhilHealth. One is the rebate or the kickback scheme. The others, the non-existing patients. Others are of course, the ghost patients, the padding and overpricing, as well as schemes within the legal department. But before we tackle that, I'd like to ask you, Secretary, what is the focus of national government? Is the focus particularly on the Philippine health insurance system? Is the focus skewed towards private HCIs or private healthcare institutions? Or shouldn't we focus on the government hospitals, improving government hospitals? Mr. Secretary.
Um, the your earlier statement, I hope you don't mind. What year was that when you said that you had expanded the hospital system of Bukidnon? Was this 2014?
No, Secretary. That was as early as 2005. I think 2005. I think you were still health secretary, if I'm not mistaken. We started that system about 2005. You have several actually vice presidents who can testify on that behalf. As a matter of fact, the staff of Senator Pia, who at the time was the chairperson of the Committee on Health, had done a field trip to Bukidnon because we were one of the first with the no balance billing payments. But anyway, yeah. So going back to my question, Mr. Secretary, are we scored towards giving the funds more to the private institutions rather than the government institutions? Because as records show, Mr. Secretary, a lot of government institutions are still waiting, no, for their IRM releases as well as improvements in their hospitals. And the reason why I asked the Secretary is, for example, we give a lot of funds to WellMed, to Brown, Avitum, and all that. Why don't we set up the dialysis centers within the government hospital system where we have provincial hospitals and regional hospitals, Secretary?
Yes, thank you, Your Honor. I believe we have been expanding our dialysis, public sector dialysis centers. No? Marami na po tayong natulungan year in and year out during the budget season. A lot of capital outlay on dialysis units have been provided by the DBM. And so you're right, we continue to expand the public sector, but the way we treat our supply side of the healthcare with PhilHealth as the major financier or funder, we just have to make sure that the outcome of care, whether it's public or private, is of quality, and it's something that the members truly appreciate and are benefited. So that to us is the overarching consideration.
Yes, because Secretary, it saddens me to see, for example, even in our province here in Mindanao, hospitals that were once clinics. That saddens. I'm happy to see it, no, but infirmaries or clinics, private clinics, are now 5-story hospitals because of course, the influx of the PhilHealth program. Whereas I've seen government hospitals deteriorate, no expansion unless the local government units give them the additional funds. They have no equipment. They beg their provinces, they beg the local government units for this equipment. And yet, it seems now, as a fact, that a lot of our funds in the PhilHealth, especially in the IRM program, is designed to go towards the private sector. I have nothing against that, Mr. Secretary, but I'm a true believer of the Cuban system, the European system, the system that they have in Italy and Spain and in France, where they really strengthen. No, the state really strengthens their healthcare institutions, and it's free to the public. It's free to the public because government pays for it. That my point being, secretaries, we have uncovered a lot of schemes involved mostly in private HCIs. And as one of your staff in the Philhealth said a week ago, that we are almost bankrupt. Philhealth is about to be run to the ground if there's no additional government funds infused into the program. Now, ang katanungan ko, Secretary, no, we need, and yesterday, this came out in the House of Representatives, and this is very clear. In the House of Representatives, lumalabas na billions ay binibigay sa mga ospital sa pribadong sektor na may mga fraudulent cases pa pending sa PhilHealth. Ibig sabihin, may mga kaso, nahuli na, pending yung mga kaso, and yet, naglalagay pa tayo ng pondo sa kanila. So, walang natatakot because there's no enforcement of the penalty provisions of the law. So, my point now, Secretary, is, don't you see a need also policy-wise to strengthen the legal department of the PhilHealth?
Oh, yes, I agree with you, Your Honor, that there has to be a beefing up and augmentation of the legal office of PhilHealth to make more efficient the legal process and to really put those people who are accountable, make them really face the consequences of their nefarious activities. No, if they are proven to be in cahoots
And
with
yes,
all
and
of
yet,
this.
Secretary, sorry, I have to
Yes.
cut you off, Secretary. I only have 10 minutes, and I would like to ask another resource person. But, do- but, and yet, Mr. Secretary, are you not surprised why no cases have been filed on several instances? And if there were cases that were filed very lightly, many of them do not even lose their accreditation. They're not even suspended. It's just a mere fine. Aren't you surprised about that, Secretary, policy-wise? Because if you want to plug the leakages, we have to be strong on the implementation of the law and basically also the penal provisions.
I agree with you completely, Mr. Senator. It's just that in some instances, the problem of access hampers management to pursue, say, the revocation of accreditation simply because the next hospital is probably 100, 200 kilometers away. And so, what the management has done is, in lieu of the revocation or suspension, was to max out the penalties or fines in terms of monetary penalty.
Correct, Mr. Secretary. But remember, in one case, the fine was 100,000 pesos only, and therefore these hospitals could easily pay the 100,000 pesos. Tuloy ang nakawan. And that is my point being, without this proper enforcement of the law, they will continue to steal the money of our PhilHealth program. And so, Mr. Secretary, if you allow me, maybe I can direct this to the legal department. And that is why it is very important, as big brother in the board, that you have to see this. Because if not, PhilHealth will just end up shutting down because of these leakages. Mr. President, may I now may I also ask questions to VP Attorney De Rosario?
Your Honor, if I may
Yes,
just very,
Secretary.
very quickly, Mr. President, Your Honor, just very quickly, I just want to add that the GCG, the Governance Commission for GOCC, recently approved 12 additional plantilla positions for lawyers, and the PhilHealth needs to be more competitive in offering these positions to competent people, and this is again an issue of compensation. Now, as to the 100,000 penalty imposed, as you have pointed out, at that time, that was the allowable penalty under the law. With the universal health care, it was doubled. So, mas mataas na.
Well,
Patients will
Mr. Secretary,
suffer. Yes, sir.
I have to cut you off, Mr. Secretary. I'm running out of time. My apologies. But that 100,000, 200,000 does not make an impact. However, suspension of accreditation does. Because in this particular case, the hospital was getting 20 million a month rebates from Philhealth. But with the suspension, they would have lost that kind of amount. That would have scared them out of their wits. That would have made them stop their fraudulent schemes. But not a mere 100,000, Mr. Secretary.
Yes.
And by the way, that was an order by a higher court to be implemented, but was skewered backwards by the board. Instead of implementing the order, they decided to just go with the penalties. That is why my first opening question to you, secretaries, don't you think we should strengthen our public health centers, the hospitals? Because if we had a PGH, we had the Don Vicente Soto in all our regional centers, all our provincial hospitals, then we would be relying on them more, strengthening them, making them stronger, so that the people can go for true universal health care.
Oh,
Mr.
yes, sir.
President.
Yes, I agree with you. For as long as the access as a fundamental issue is addressed.
Yeah. I'm glad you're here, Secretary, so you can hear also our exchanges on the issue on the legal, the problem of the legal department. Mr. Attorney Del Rosario, may I ask you some questions, sir?
Yes, Mr. President.
Yes. Attorney Del Rosario, it's come to my attention several cases that were filed by your rank and file, particularly investigators of the Philhealth, on airing hospitals and airing personnel. But I was told that these cases were either brought down to mere uh, uh, administrative cases rather than criminal cases, as well as cases that are still languishing in the legal department. May I ask, Mr. President, Attorney Del Rosario, how many cases have actually been filed in court
Thank you, Mr.
against these
President.
healthcare institutions?
Thank you, Mr. President. That's one of the problems that I discovered when I assumed as head of the legal sector. I assumed in 2018, kalahati lang po ng taon. Tapos last year, kalahati din lang ng 2019 ako nasa. Yung isa pong problema, yung filing of criminal complaints before the Department of Justice no sa mga regions. When I assumed there was 11 lang po yung na-file natin na complaints ever since PhilHealth was established. So that's the reason that we endeavored to direct the regional offices to file criminal complaints as well as complaints before the Professional Regulation Commission. And
Pero
also,
attorney, allow me to, yes, attorney. Attorney, ang balita sa akin ng mga taga-region ay ang proseso daw ay iaakyat yan sa inyo, sa legal department sa Manila, sa central office, and these are where the cases are languishing. Can I give a simple example, Attorney Del Rosario? Itong Pamela Del Rosario case sa Region 1, I believe you were the regional director at that time. And your investigators had uncovered about 10 employees who were positively identified by Philhealth. These were identified by the anti-fraud personnel. And yet, most of these cases were either simple neglect only, although the recommendation was for dismissal and filing of charges, criminal and administrative. It was mandated to simple neglect only, and most of the cases were dismissed. Can you confirm that,
thank you,
Attorney?
Mr. President. When that happened, I was not yet the regional vice president of Region 1. That's the reason why I was transferred to Region 1, because there was a controversy. No? But in 2013, I was assigned to Region 1 for about 7 months. No? But
Yeah, but I have a document here, Mr.
Yes.
President. I have a document here. It's addressed to you, Attorney Dodolfo Del Rosario, Regional Vice President, Region 1. This was dated 3rd of October 2016, where all the cases are here, and they were filed to your office, Mr.
Sorry,
President.
Mr. President. That pertains to another case that is against a certain hospital. That's what I was saying all along, Mr. President, that there was a problem in the filing of criminal complaints. And that particular document, I've not seen the document. No, they forwarded that to the legal office, and no draft of any criminal complaint was forwarded to the office of the regional vice president in that particular case. But I was explaining earlier regarding
Yes, may you explain to me, Mr. President, may I ask Attorney Del Rosario? So explain to me these particular cases on the Pamela Del Rosario. This
Okay.
was literally the hand got caught inside the cookie jar. Huling-huli talaga sila.
Yes,
And
sir.
yet, no cases were filed against these people. Is
Sir,
that correct?
As I mentioned, that happened when I was not yet the regional vice president. The Attorney Padilla requested me or reassigned me to that office when that controversy erupted. No? So there is no, the regional vice president has no official role in the investigation of that case. That was investigated by the fact-finding, investigation and enforcement department. And the preliminary investigation was conducted by the prosecution department, all in the central office. And the Ombudsman also conducted its investigation, as well as the National Bureau of Investigation. And the Ombudsman found one employee guilty, and she was dismissed from the service, while several others were filed with administrative cases. There was an ad hoc committee created for that purpose, and that heard the case. I have no official role in all of those processes, Mr. President.
Well, Mr. President, on another issue, as mentioned earlier, this case on the Corpus Hospital, where 220 cases against the this healthcare institution were forwarded by the Fact-Finding Investigation Enforcement Division for filing with the prosecution office. I guess that's your office, attorney. Pero until now, wala pang kinakasuhan. Don't you agree with me, attorney, the lack of prosecution, the lack of penalties will continue to allow these people, whoever they are, unscrupulous individuals, to continue their shenanigans?
I agree with you, Mr. President. And with the limited time that I was in the legal sector, I have already recommended the filing of criminal complaints against 1,003 of healthcare providers. Our regions, as mentioned by the Secretary earlier, we had some administrative capacity issues. So the GCG recently approved the creation of additional 138 positions to strengthen the enforcement mechanism of our Philhealth regional legal offices, Mr. President. I agree completely with your observation.
Yes, attorney, but unfortunately, the proof in the pudding is in the eating. So therefore, if you want to be able to show us that you agree with me totally, these cases have to be filed. Imagine we invested billions again in this IRM system the last 2 months with hospitals, and I don't know, you can confirm this. We have reinvested the IRM funds to hospitals once again that have still fraudulent cases pending with your office. Is that correct? You can confirm that.
Yes, that is correct, Mr. President. The rationale of the policymakers is that these providers are also needed to extend assistance to our members. But that is correct. The IRM was given to even to those that have pending cases before us. And to put it on record, Mr. President, for the past 2 years that I've been with the legal office, we have filed more cases. Makikita po ninyo na napakarami na po yung na-file natin at na-resolve pong cases sa legal. Ang problema lang po natin, ito pong pag-file ng criminal complaints, which is a function of our regional offices. They have managed to file out of 1,003 cases that we have only 15 so far, only 11 so far. But this is
So,
also...
so as an analogy, attorney, you would say na parang biro mo, nahuli mo na yung magnanakaw, pero tuloy-tuloy pa rin ang hindi nyo nahuli ng nagnanakaw yung magnanakaw, pero hindi nyo dinalagay sa kulungan, tuloy-tuloy pa rin ninyong binibigyan ng pondo itong lugar na ito para tuloy-tuloy ang pagnanakaw. That's a possibility.
Mr. President, there are other remedies aside from the filing of cases. We have uh, 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 denied the renewal of accreditation of several providers. Ang problema kasi, sir, sa due process natin, sa quasi-judicial process ngayon, medyo napaka-stringent niya, no? Kaya we are now recommending for the revision of this quasi-judicial provisions of our implementing rules. So sana para mapabilis na po. Ngayon, we can of the providers, and we have done that. We have also pushed for the policy on the withdrawal of accreditation. Pag meron pong talamak na fraud, the region can withdraw.
Yan ang napaka-importante, Attorney De Rosario, because that's what scares the living daylights out of these erring HCIs. Kasi kung hindi nyo gagawin yan, hindi matatakot yung mga yan. Now, the problem is, if there's a lack of enforcement, it becomes a leadership issue. It becomes, as Senator Grace mentioned earlier, competence or malice. It's either incompetent or malicious. So yan yung nangyayari dyan. Kaya we have uncovered so many schemes, bilyong-bilyong pisong nawawala sa Philhealth dahil nadayas. There has to be two to tango. In other words, there has to be two to tango. Kasi kung matatakot yung mga hospitals at HSCs at wala silang kasabwat, hindi nila gagawin yan. Alam ko po yan, sigurado ako, hindi nila gagawin yan. Kasi alam nila paparusahan sila kaagad, Mr. President. Pag hindi mo sila paparusahan, wala talagang mangyayari. Tuloy-tuloy ang ligaya. Sabi nga ni Senator Bongo, Mr. President kanina, sana putulan ng daliri. Ang problema, siyam pa ang daliri ang naiiwan. Siyam pa. So, pwede pa yung siyam na daliri na yan. Ipasok ang pera sa loob ng bulsa nila. And also, finally, Mr. President, finally, I would like to ask, I don't know, Mr. Morales is not there, General Morales is not there, unfortunately. The NBI admits, last August 7 in an interview, that they have had difficulty in investigating fraudulent Philhealth claims, since the Philhealth has not been submitting records to them despite repeated